Namaskar, I am Dr.Deeksha Tiwari, fertility specialist, New Hope IVF Indore. I have been practicing in this field since last more than 10 years, and during this period we have been regularly seeing that whenever a couple is trying for pregnancy and they are continuously trying for it and they are unable to conceive, they become really frustrated, depressed, and they avoid social gathering and they become a social outcast. So if you are trying for pregnancy and unable to conceive, then you have to consult a specialist near you to discuss that what are the problems which can lead to these kinds of situations, because you will be surprised to hear that if you are facing such kind of problem, then more than 50% of the couples can conceive naturally without requirement of any major treatment. So this is a very important and surprising fact. So avoiding treatment is not a solution. You should go ahead, discuss, and to understand what problems you're facing, the doctor will advise you some kinds of tests. This may include some of the blood test and some tests. To understand the requirement of the test, I will just make you understand that what is a natural conception process. So if you can see this diagram is showing a uterus, fallopian tube and ovaries. So what happens in a natural cycle, whenever a woman ovulates, then one egg is picked up by this fallopian tube and sperms all the way travel from the uterus and they travel to this fallopian tube. They reach up to the egg, they fertilize the egg. Then after fertilization, the embryo remains here, and after 5 days at the blastocyst stage, which we call it reaches the uterus and implantation occurs inside the uterus, and after 9 months delivery happens. So this is a normal process of conception. So to understand what problems you are facing, the doctor will advise you some tests that will include a sonography, which will help us guide whether there is a problem inside the uterus or the ovaries, or there is a semen analysis test which tells us about the sperm's number, the quality and motility, and we can advise you an HSG, which is a tubal patency test, to understand if there is any problem in the tube. So if the reports are coming normal and you have been married since 1-2 years, not much time has been gone, so they will advise you some basic treatment, and you can conceive with the basic treatment only, and they may suggest you IUI, seeing the marital life and assessing the husband counts. If there is a mild male factor infertility, some motility is less, count is little less, then you may be advised IUI. IVF is suggested only to that portion of the patients in which there is a major issue, like suppose if the tubes have been damaged due to tuberculosis, there is fluid, there is collection, there is hydrosalpinx, then tubes have been damaged, or you had one child previously and tubectomy has been done, recanalization have been failed, then you may be advised IVF. Or due to some reason, if tubectomy has been done, like if you had faced some ectopic pregnancy or so, and if the egg counts are less, your AMH has coming down rapidly, the AMH has become low, or there is an issue with the uterus, like there is the endometrium is damaged due to a previous infection, tuberculosis, or previous history of DNCs there. If you have attempted multiple DNCs and after that there is a damage in the endometrium, or maybe many factors which is leading to these situations, then you may be advised IVF. Or if there is nil sperm count, if your husband is coming to us with 0 sperm count, then there is a process which is called as TISA. We do this and we extract sperms from the testis of the male partner, and we can go ahead with the self sperm in cases of 0 sperm count also. And if there is low sperm count, the morphology is less, the motility is less, there is a major male factor infertility, then you may be advised ICSI in case of these tests. And nowadays, another indication for IVF is that if you have been married at a younger age and now you are planning for a career, especially for a female, so what you can do nowadays is at the age of 25-30, you can go ahead with your egg freezing. You can go ahead for egg freezing, and after freezing these eggs, you can plan your pregnancy later on in life, like at 35, 36, 37. At whatever age you can plan, you want to plan your pregnancy, you can plan with a younger age freezed eggs. So what is the benefit of egg freezing is that the most important parameter to assess egg quality is your age. So younger the age, better the chances of success of whatever treatment you are going for, lesser chances of abortions, better chances of getting a healthy baby. So this is also an indication. And another one is that if you are facing any situation like cancer, so nowadays the survival rate of cancer has been increased tremendously. So if you are facing such kind of situation, firstly you can freeze your sperms, you can freeze your eggs, then go ahead with the cancer treatment. And whenever you are declared cured with this whatever cancer you have, then you can go ahead planning your baby further. So if you are facing any of the problems and if you have been advised test and you are already having reports, or you have not met any specialist and you don't know what is happening with you, then rather than depression and frustration, go ahead, meet your doctor, discuss your problem, and after understanding the problem, go ahead with the treatment and have the pleasure and happiness of having a baby at your family. Thank you.